It's no secret medical professionals on the front lines of the coronavirus crisis in America are facing a shortage of personal protective equipment. The demand for these medical supplies is especially high in New York City, the epicenter of America's coronavirus crisis, where, according to the White House Coronavirus Task Force, almost 14 in every 1,000 people is infected. N95 and surgical masks are among the most needed protective equipment. A New York City based doctor turned to Facebook, where she made desperate pleas on local moms groups. The donations started pouring in the very next day. Dr. Reem Sheikh joins me now. She's an attending podiatrist at New York City Metropolitan, Lincoln, and Harlem hospitals. She's also surgery faculty at the New York College of Podiatric Medicine. Dr. Sheikh, thank you so much for joining us. Let's talk about how this all began. A GoFundMe page started by some of these moms has raised more than $17,000 to buy this equipment. What have you been seeing? What have your interns been seeing on the front lines that made you initially turn to the public for help?
Hi, good evening. Thank you, first of all, for having me. As you said already, yes, this campaign took off. It started with a plea about 2 weeks ago on a Friday night at midnight for a pair of goggles for myself and my residents. And this is just when, we were starting to see a surge of COVID patients in New York City. I had myself struggled with finding a mask, and I realized, after speaking to my residents and my other staff and colleagues that masks were limited. There were some, but of course, whatever we had, we're using for a week at a time. Also, I could not find any goggles or face shields at the time. So I thought to myself, what does a mom do? Mom seeks advice from fellow moms. So where did I turn to? I turned to my local mommy Facebook groups. I posted a plea at, Friday midnight, like I said, for goggles, and the next day, and for masks. And within less than 12 hours, I had 40 pairs of goggles and about 300 masks. They were brought to the hospital right away, given to my residents and put to use, and other nurses and also other healthcare providers. And it was put to use right away. And as I continued my pleas, I was joined by community members who started a GoFundMe. As you can see, it has been very successful. It's a very transparent campaign. We seek vendors, US-based vendors, and everything is hospital grade quality. So nothing fake from China or anything like that, but everything that is hospital grade, medical grade quality that's distributed to healthcare workers on the front lines.
So, explain the importance then of properly sourced PPE as you just described. What is the problem with a lot of this stuff coming off of the black market?
Well, you see, the issue is that if I have a mask that is from the black market, it gives me a false sense of hope and protection. And I'm far worse wearing a mask that will not provide me adequate protection than not wearing a mask at all. So it's very important that we have, supplies from US-based vendors that are medical grade for healthcare providers, because it's better to be protected correctly than to have a false sense of protection, because that is dangerous for us and for the patients as well.
And are you seeing that? Is there a problem of a lot of products from the black market circulating in hospitals?
Well, not circulating in hospitals per se, but now that I have, a group of my 4 or 5 volunteers that are helping me, they're approached constantly by such vendors. And that's why we have a very thorough process where we vet the products and, simply US-based suppliers, and they're hospital medical grade certified products. And so it's not circulating through the hospitals that I'm at. That I cannot, confirm. But it is an issue out there.
Right. And doctor, what are you hearing from other medical professionals and your residents who are now receiving this equipment?
Well, they're very grateful for it, because you see, we may not be short of all personal protective equipment altogether. We have gloves. We now, have a mask a week that we can use. I've had my mask that I've been using for the past 2.5 weeks, actually. I operated on Friday. Only emergent cases are happening now. And I keep my mask, it's in my little container here, and I use it. So it's a hot commodity because we have limited quantities. Yeah. So residents
Now,
are very
are
grateful.
masks normally meant to be Sorry, there's a little bit of a delay, so sometimes we overlap each other. But are masks normally meant to be used that long, one mask for a week?
Well, one mask should be really used per patient encounter because you see, I have to protect myself and also the patient. So if I'm not protected, the patient is also not protected. But it is no secret that masks these days are short. So that is why through these donations, we've been able to get, certified N95 masks and KN95 masks that have gone through proper vetting. Nothing that is not certified is given to the hands of healthcare providers.
And doctor, from your residents who are on the front lines in the emergency rooms every day, what are you hearing about the current situation in New York City?
I mean, it is a stressful situation, right? That's no secret. My residents, my colleagues, nurses, PAs, they're all on the front lines. It's in the emergency room, ICU units. I mean, we have entire hospitals that used to have a wing of ICU units now turned into COVID treatment centers because we're being hit so hard. So they're doing everything that you can imagine. They're taking blood, they're doing chest compressions, they're putting it in, taking out central lines. They're involved, actively involved in saving lives. And this is across the board, all healthcare workers that are at the hospitals.
It's it's amazing. And doctor, how can people help who want to make donations to this cause?
It really is commendable. I am so proud to say that I work with such a brave group of people. I really do not have words to say how humbled I am with, their dedication to protecting the patients, to treating the patients, and by the community's support. There's a GoFundMe that we started. Like I said, it is a transparent campaign. We raise the funds, we vet the products, and then they go directly into hands of the healthcare providers on the front lines.
Well, Dr. Reem Sheikh, thank you so much for telling us about this initiative and for getting the word out there. And thank you so much for all the work you and your residents are doing on the front lines during this time. Thanks for being with us.
Thank you. Thank you so much. Thank you also to the moms, because you know what? Moms get things done. So thank you.